Hello people, my topic is Glecaprevir-Pibrentasvir for 8 or 12 weeks in ACVT genotype 1 or 3 infection. My name is Oscar Yupabuñay, Medical English, Dr. John Moscoso. Definition. Mevorat is an antiviral medication used to treat adults with hepatitis C, an infectious disease that affects the liver and is caused by the hepatitis C virus. Long-term chronic, this medicine contains the active substance glycoprevir and pibrentasvir.
Glecaprevir-Pibrentasvir, as you pointed out, already has a treatment indication that was back in August of 2017. The unique aspect of it is it's approved at 8 weeks duration for a large population. So anybody who is treatment naive and non-cirrhotic, regardless of what their genotype is, gets 8 weeks of therapy is what's recommended. So that's the broadest indication for an 8-week regimen that we have. And because it's available for 8 weeks for a large proportion of the population, and was priced relatively aggressively. Let's face it, the price sometimes matters in what the options are for practitioners. It's becoming more increasingly used. And so what this study, I think, provides is maybe some level of comfort for the very small percentage of patients that may fail, that we at least have some data on how to approach their retreatment. Again, overall, in kind of the registrational studies, 98% of patients were cured. There was, about a 2% failure rate. So most are going to do great with this regimen with just Glecaprevir-Pibrentasvir for 8 weeks. But again, if you do have a failure, because both these drugs have a very, very high barrier to resistance, and that comes to Pibrentasvir, the NS5A component in the regimen. But there were many more patients, including patients that had both protease inhibitor and NS5A inhibitor resistance, that were cured in this study. All 5 that had dual resistance going in were cured. So, whether resistance testing is going to play any role in management of these, still an open question from this study. The numbers are too small, but it doesn't look like resistance is necessarily a big component of that. Fibrosis stage, so cirrhosis, is probably the biggest factor in retreatment of these patients. That was seen in this study. The one failure was a cirrhotic. You can't say anything with any certainty. But in other studies too, it seemed like cirrhosis.
Application in medicine. Mevorat works by preventing the hepatitis C virus multiplying and infecting new cells. In this way, the infection is eliminated from the body. Pros and cons. Pros. For the treatment of adults with genotype 1 or 6 of chronic hepatitis C virus without cirrhosis and liver disease or with mild cirrhosis, including patients with severe to moderate renal impairment and those who are in dialysis. Cons. Headache, diarrhea, nausea, fatigue, asthenia.
Often undiagnosed, unaware, or stigmatized, life can be challenging for the up to 71 million people worldwide infected with the chronic hepatitis C virus HCV. With a proud legacy of 30 years in HCV, AbbVie is committed to helping end this disease. We are guided by our people, powered by passion, and in awe of the possibilities ahead of us. Through our work with our partners, we focus our efforts toward research and actions to meet the needs of our patients. We research medicines and advance scientific evidence. And we take action through collaborative, localized solutions. We amplify awareness and advocacy for better prevention, screening, and linkage to care. We foster dialogue and catalyze action toward better patient management. We build capacity through education. It's a comprehensive task. At AbbVie, we care about making a remarkable impact on patient lives. We are determined to help end HCV together.
Pit in Ecuador. They were recently donated to the MCP and their disease stored no date on their application for the management of HCV. Conclusion. Once their treatment with Glecaprevir-Pibrentasvir for either 8 weeks or 12 weeks achieved high rates of sustained virologic response among patients with HCV genotype 1 or 3 infection who did not have cirrhosis.
Hepatitis C has been getting a lot of press recently because we have a lot of new medications coming out for hepatitis C. The problem with hepatitis C long term, just like with any hepatitis, is if you have active inflammation in the liver, the problem with that inflammation is eventually it can turn into scar tissue, and that's what cirrhosis is excessive scarring in your liver. And then so hepatitis over time can lead to excessive scarring in your liver and even cirrhosis. So I quote patients, if they are acutely exposed to hepatitis C, in general, they have about an 80% chance of developing a chronic infection. And out of that 80% that has developed a chronic infection, around 1 in 4 will potentially develop cirrhosis over their lifetime. And then once they develop cirrhosis, they have about a 3 to 4% chance per year of getting worse or decompensating, where the only thing that could potentially help them in the future is a liver transplant. There is a treatment and a cure for hepatitis C, which a lot of patients don't realize. Some patients know that there is treatment for it, but they don't realize that this treatment can actually cure hepatitis C. Hepatitis C treatment really has been revolutionized over the last few years. Treatment in the past has included a shot once a week with pills every day. Unfortunately, may work 50% of the time in certain subtypes of hepatitis C, and you're kind of ridden with side effects, and treatment could be as long as a year. But now, since 2011, we've developed new oral agents for hepatitis C. So we've been able to get rid of the shot component of it, and recently, over the last year, we've been able to do all pill form of hepatitis C, which has given us a much higher chance of curing the disease, and then 2, it's much better tolerated, fewer side effects, and a lot of patients don't even know that they're even on the treatment.